Okay, so let's talk about some sensory impairments. We're going to talk about hearing impairment first. Hearing impairment is classified as slight to moderately severe or severe to profound hearing loss. If hearing allows successful processing of language, then that patient may require a hearing aid, but may be able to use mouth words, use spoken language. If hearing is so severely impaired that the person cannot process auditory language, even with a hearing aid, then they need other methods of communication. That can also be associated with speech impairment because they're not hearing language to be able to develop that speech impairment. So hearing loss can be inherited. It can be due to an anatomic malformation. It's more common in kids who have low birth weight, perinatal asphyxia, or infection. Chronic ear infections can cause hearing loss. Cerebral palsy and Down syndrome are associated with higher risk of hearing loss. Prolonged high level oxygen therapy is a risk factor. There are medications that can be given that damage the auditory nerve, ototoxic drugs, and noise exposure. So there are a lot of different potential contributing factors. Pathology-wise, hearing loss can be conductive or sensory neural. And conductive means that the sound is not being transferred to the middle ear. So we have something missing, that the sound is not getting there. Sensory neural means that there's damage to the inner ear or the auditory nerve. So the sound is not able to be perceived. Sounds may be perceived. They may be not perceived at all, or they may be perceived and be distorted and difficult to discriminate. And then there are causes of hearing loss that are mixed. There also are central auditory imperceptions, which means that for some reason the brain just cannot receive that stimulus and translate it into a meaningful message. Managing conductive hearing loss can improve if some causes are treated. So if it's due to chronic ear infections, that can be treated. If it's permanent, then hearing aids can be helpful. For sensory neural hearing loss, hearing aids are not helpful. A cochlear implant provides the sensation of hearing. If it's used before 18 months, and that child is most likely to be able to develop spoken communication. And we're going to talk in just a minute about why some families choose not to do that, or why some deaf people choose to discontinue use of that. Diagnosis, babies are hearing screened at birth to identify early so that we can establish communication. Kids should also be screened at well visits. We also can be observing how does that infant respond to auditory stimuli. Milder hearing deficits may not be obvious at first. It may look more like they're having difficulty learning or difficulty with articulation. So communicating as someone who has hearing loss, or who is either hearing impaired or deaf, what types of communication can be helpful. So a lot of people with hearing loss that are not completely deaf may use lip reading. Cued speech uses some signs along with lip reading to help them understand what's being said. Sign language is the most common for people who are completely deaf. And then there are people who are deaf who work to learn speech with words. Sign language is a different language. There are quite a few people who are deaf who prefer to communicate in sign language rather than being asked to speak. Safety and independent living. Someone who's deaf can live independently. They need some safety accommodations, like anything that has a sound, light, and vibration can replace that. So like an alarm clock can vibrate. Well, phones have a vibrate function for alarms, right? Flashing lights, a doorbell can be rigged to flash lights, or can be wired to flash lights. Some people have hearing ear dogs. There's closed caption, and there is technology to for people to use phones. So there's a lot of technology that's been developed to assist people who are deaf with communication. Socialization, hearing aids may help reduce some of the background noise and help people hear what they're, no, hearing aids, sorry, pick up a lot of things, and there may be extra background noise, and that background noise may need to be reduced for someone who's using a hearing aid to hear better. We talked about some of the facilitated communication techniques. We need to teach that child's classmates, friends, and family how to communicate with them. And the family really needs to learn ways to communicate with that child rather than exclude them. And sadly, that happens a lot. There are kids who may have learned sign language, but a lot of their family members won't learn sign language and try to communicate with them, or will tell them they need to be still and not move their hands and try to make them use speech. So there's still a lot of discrimination that we need to work on. If you're speaking with someone who reads lips or who maybe has a hearing deficit, you need to face that person and enunciate clearly without exaggerating, so to make it easier to read lips. Families need lots of emotional support. If someone with hearing loss is hospitalized, we need to be working on making sure we have clear communication and check for understanding. We need to make sure that the child or that patient can see the nurse before we begin a procedure, so we don't just grab them and scare them. And parents should be encouraged to stay with that child. We can try to prevent hearing loss or prevent some causes of hearing loss by advocating for treatment of otitis media, avoiding ototoxic meds when possible, infection control, education about noise damage, and things like that. So some deaf individuals do not see deafness as a disability, but rather as a different normal. They may prefer to interact in deaf culture. If their children are deaf, they may not choose to pursue hearing or spoken language with them. They may prefer to interact in deaf culture. So the next section is going to be about visual impairment, and then we'll talk about kids who may have both hearing and visual impairment.